Hey guys, Dr. Mike here, Oak Brook Medical Group in Oak Brook, Illinois. Low back pain is everywhere right now. People are talking about it. We have a slew of patients coming in complaining, back hurts, sciatica type stuff going on. And this is one of the reasons. Kenya in the perfectly poor position. So let's talk about it. I want to talk about how you guys should be sitting in a chair. All of this stuff we're going to talk about is part of the PT that all our patients go through. We need to teach you proper mechanics, proper biomechanics, how to move, how to handle things, how to handle more stress so that you're less likely to get injured as you do your daily activities. So, like I said, Kenya, perfectly poor position at this point, just kind of slouching, relax. And we all do this, right? This isn't how she actually sits. We're making her be the bad example. It's fine. But everybody sits all day long at work. So typically this is what happens, right? We're away from the back of the chair. We let the shoulders round out a little bit. We just kind of slouch. We're all on our keyboards working this way. So biggest thing, especially when it comes to the low back, is I always want some type of support. So the chairs that we're using here, this is where our patients warm up. We've got this wobble cushion that patients sit on to warm up. So even this chair I would not say is perfect for posture, but we're going to use it for example purposes. So what I want Kenya to do is she's going to slide back towards the chair. In a perfect world, she's sitting nice and upright and tall, and we have some type of support in this lumbar. So you can see, even when she's sitting up tall right there, there's still a gap right here. So ideally, what I want you guys to do is you could even just take a towel. You roll a towel up so it gets to be about that round. Everybody's low back's gonna be a little bit different. And you're gonna set it right on that back of the chair so it's supported from the lumbar spine to that back of the chair. Now you feel like you have a nice lumbar support. So a lot of cars have this now. They have that lumbar support. You can move front back. So even in the car, sitting nice and upright, make sure that that lumbar support comes back, contacts your low back. Don't make it feel like it's jamming into your low back, because then you'll be calling me names while you're driving in traffic, and I don't want you to do that. So just enough so it feels supported. But from there, just like she went when we talked about it, everything stacks up at this point. So ears over shoulder, shoulders over hip. When we are sitting for the low back, whether this is in a chair or a car, and I know we've done videos on these before, but not everybody does it, so we're going to do it again. I want your guys' hip and thigh and knee all to be sitting there at 90 degrees, right? So she's not sitting like she's scrunched up this way. Things aren't overextended. Everything's nice, 90 degrees. Feet are flat on the floor. She's looking straight ahead. All of this stuff that we just talked about, it seems elementary. It seems like you should just know how to do this. It's just not the case anymore. As individuals that sit at a computer all day, move around, stare at a screen, all of these things, we've gotten really poor with these mechanics. So we almost have to be intentional with it and work with it. Again, this is all part of what we do in the office when we're treating our patients, going through the physical therapy and all the biomechanics stuff. So if you are dealing with low back pain, sciatica type pain, anything in that low back glute area, call us at that number below. We'll walk through, assess everything, see exactly what's going on, but more importantly, get you out of pain quickly. So we look forward to seeing you guys and working with you soon.